I'm Dr. Noorul Ameen, Chairman and MD of Qualitas Medical Group, and we have been around for about more than 22 years. We have been discussing on various programs, and when the National Heart Day in this month, so I think we came across that why don't we do a service to the community? Why don't we do free screening, cardiac screening in the terms of ECG, and then will be supported by the hospital. It will be all free for the patients. We will screen them, and if I have any abnormality in the screening, we will get a second opinion from the CVS doctors, cardiologists, and if they find it's okay, fine. Otherwise, if it's abnormal, we will advise them. They will advise what to do. All this stage will be free. Only if they have to the second stage of treating them or dealing with that, then I think they need to either whoever is a payer will be. So we just wanted to screen them to make sure it bring awareness of the cardiac problems. ECG is electrocardiogram, or in some certain countries known as EKG. They call it EKG. Yeah. This is it just captures the electrical and muscular activity of the heart. If there is any change in the heart, as you know, the blood supply to the heart is end arteries. End artery means it ends there. It doesn't connect anywhere. So if there is a block anywhere, that part of the muscle dies. So because of the activity, we are able to capture in the ECG if there's any abnormality in the heart muscle, in any abnormality in the conduction of blood flow. There are certain issues we can see. It's a screening mode. It's not you to some extent you can diagnose. It's mostly a screening to see is there any abnormality or not. So I think that's important to do to make sure that the ECG is normal. And if there is any abnormality, what do we do about it? We think that because of the increase in cardiovascular diseases in this country, and also because of our concern for the welfare of the citizens, I think we came up CVSKL, and we came up with a plan that why don't we offer free screening for our citizens to help them create awareness that this is a serious issue we need to take care. And we come together to provide this for free for 3 months or 5,000 patients in our centers, so that we can educate them and create awareness about this cardiovascular disease in Malaysia. Any Malaysian citizen above the age of 35 is eligible, and in any one of these clinics, which you can check out the website, and we will be entertaining. I think the 10 clinics in Klang Valley will be participating, and it will run till December, but we are prepared to extend because our benchmark is 3 months and 5,000 patients. Whichever comes first, we will follow that. I think it can be extended depending on, we are just doing a pilot project at Klang Valley because it's easier for us to refer to the CVS, which is also in Klang Valley. But as for second opinion, it can be anywhere. We are just on a trial basis. If it's successful, I think we can extend throughout the country. I think it's one of the major killers in this country, cardiovascular disease. And I think what worries us, people like physicians like us and also cardiologists, that the age group is getting younger and younger. That's worrying for us. It was in the 60s, now it's in the 50s, and we are even seeing people having cardiac issues at the age of 40s. That is what is worrying, and we would like to really see how we can help the society more knowledgeable to prevent this at an early age. And it's also a fact that if you have cardiac problems at a very young age, the complications and all that, and then the morbidity of the patient sets in very early. If you have a cardiac complication at the age of 60 above or something, the morbidity and mortality is lesser than at a younger age. So that is a very, very worrying trend. No, I think people are a bit more worried now and also more knowledgeable. I think it will come to some kind of point where the people will realize that I think this lifestyle cannot go on. I don't think it's keep on going to increasing. I'm confident that with the public sector like us and all the government sector and various NGOs, if they can bring about some knowledge into the public and tell them what is causing and how we can help them, I think it can be arrested. I think multiple factors. I don't think there is any particular factor. Multiple factors like the diet, lifestyle, sedentary working. There's no much of physical activity in some people. And more so is a stress factor as well. It's also important. I think the way the lifestyle in mostly urban areas have changed a lot compared to the previous year. People used to cook food at home and used to watch their diet. Now everybody is rushing from one place to another. They got no time to cook, so they buy from the shop or eating outside. I think we want to first create awareness among the public that I think this is a serious issue. But more interestingly, this is a preventable problem. That's very important. And if we can see that the people come in early and then treated early, and we can defer their complications and better quality of life, and I think that's something we have achieved. We see a lot of patients in our primary care setting, and if we can bring that knowledge to them and we can change their pattern of lifestyle pattern as well as eating habits and taking care of their health, we would like to see healthy patients.